we all know that today we are discussing on a problem which is called anemia. And as part of the organization, Delhi Gynaecologist Forum and North India Gynaecologist Forum, we feel our vision is that every citizen of this country should be anemia mukt. And what is our mission is? That mission is that we must make these two organizations a society of dedicated, hardcore health professionals who can definitely help as an ambassador to get Anemia Mukt Bharat. So you all know about it, that I will give you an eagle's eye view of Anemia Free India. Also, I will throw open a question and introspection by all of you that not only you should aim at 11 gram percent plus, but you should aim at 12 gram percent at delivery. This is the need of the day. And I will talk finally on which iron preparation to use in iron deficiency anemia. We all know that in 2018, Anemia Mukt Bharat and Poshan Abhiyan was started in 2018 under the leadership of none other than our Prime Minister Narendra Modi. And at that time the strategy was XXX strategy, 6 target beneficiaries, 6 intervention and 6 institutional mechanisms. The highlight of this Anemia Mukt Bharat had been that to give a prophylactic iron and folic acid supplementation in all 6 target age groups. We had heard about prophylactic treatment as far as pregnancy was concerned, but for the first time people like me heard about it. Even if your hemoglobin is 12 or 13, still you need to take a prophylactic iron and folic acid thing. So this was for all ages, not only pregnancy, for all 6 groups which were targeted groups, because the basic idea was to decrease anemia in the vulnerable groups, and these 6 target group had been identified. And I feel, you know, the government had been partial to these 6 and not included men, younger men and elder men, because they feel that, you know, they are free of anemia, but they are not free of anemia. I will talk about this. And second was intensified year-round behavior change communication campaign to see to it that people take iron folic acid and also take deworming tablets. It should become a universal with each one of you, that each patient of yours, even if they have a normal hemoglobin, they must have iron therapy and they must also have a deworm therapy. Every 6 months they should be taking it. आप हो, आपके spouse हो, आपके family members हो, when it is there for everybody. And in this particular BCC campaign was delayed cord clamping, to see to it that, you know, encourage anemia treatment, along with you must guide them and counsel them about the food, and also you tell them about the fortified foods, and infant feeding practices also, which have been advocated by the Ministry of Health, should be very strongly recommended. Third was testing and treatment of anemia using digital method at the point of care treatment, and this is specifically for 2 people, the pregnant ladies and adolescent girls. Third was addressing non-nutritional causes of anemia. Wherever you are working in endemic areas, you should see to it that the treatment for malaria, fluorosis and these things should be also given, and goes without saying that we should never forget hemoglobinopathies. This report came of NH5, National Family Health Survey 5, which was released in November 2021, and we found there was a drop, there was increase in anemia rates, and that's why all these things had been intensified. You can see this in this survey, the anemia prevalence across ages and gender increased by 2 to 9 points, and the first one were children, adolescents were the badly affected, then the pregnant ladies, women and men were there, and the largest spike was seen in children up to 5 years. And the incidence rose to almost from 62, almost 70%, close to 70%. Again, it was rural India was much more affected than the urban India. And when it came to the second highest increase also was noted after these children was adolescent girls. And here again it was close to 60%. It rose again by good 5 points or 6 points. Same division was seen that in rural areas it was more anemic than in urban India. And you could find that even a woman, it was found that from 50% it rose to 57%. And in pregnancy it was from 50 it went on to 52%. Here the cutoff had been taken as 11 gram percent. And as for the men folk were concerned, 25% of men were anemic and 31% of the boys more than 12 gram percent were also anemic. We all know that the anemia affects 2 billion children and women globally, and our USP as far as India is concerned, we are a land of anemia and malnutrition. People question many times, Narendra Modi, why are you giving free ration for 80 crores of people? And he says it is to address kuposhan, because I do not want people to should sleep hungry, and that's a proportion that that many people sleep hungry. Now this particular slide, I want each one of you should know it very well. This is the WHO model has been there as far as the anemia is concerned. It is said whenever there is a mild anemia, the deficiency of the tissue iron takes place. And this, the mild, I'm talking about just mild anemia, it decreases your work performance by 50%. And that's why we are a lazy race. We can never compare ourselves with Chinese, whether you like it or not. And it also affects the child development, and that's why more than 50% people are stunted in our country, and the school performance is badly affected. So if your child is not doing well, now the parents have started telling, the teachers have started telling, get your child's hemoglobin done and find out whether the hemoglobin is normal or not, because school performance gets badly affected, and so the IQ of the child. Now as far as severe anemia is concerned, we all know about it, that the maternal mortality increases, and we'll talk in detail about it. Perinatal mortality so will increase, and it is seen that even child mortality up to 5 years is increased tremendously. Dr. Vandana talked about intergenerational anemia. If the mother is anemic, the baby will be born which is minus stores, and naturally the kind of feeding practices we have, the child has anemia, and that's why there will be increased number of mortality will be there as a result of anemia. So I think this particular model of WHO must be remembered by each one of you, and that explains everything. Now by definition we know it's a Greek word which says lack of blood, and when we talk about the lack of blood, we also know that it also decreases the oxygen carrying capacity of hemoglobin molecule. And must remember, brain needs 20% of total oxygen needed by the body, and other vital organs also require the same. As far as the hallmark of symptoms are concerned, weakness and fatigue stand tall, and that explains everything. To this August gathering, I don't need to tell you where all to look for pallor, but what I will say that the symptoms and the signs which we ignore in day-to-day practice of ours are hair fall, headache and dizziness, loss of appetite, heart palpitation, brittle nails, dark knuckles, and tiredness. Implications to the mother and the fetus is well known to each one of you. Now when it comes to in pregnancy, iron deficiency anemia, we all know that there is, all bodies talk about that the hemoglobin should not be less than 11 gram percent in first trimester, in the third trimester, and as far as severe anemia is concerned, it is less than 7, and a very severe is less than 4. The government of India says that the hemoglobin for a person who is going for cesarean section should be at least 8 gram and above. And Indian doctors, I feel, should aim not only 12-gram hemoglobin, but not only 11 grams, but 12-gram hemoglobin at the time of delivery. And this will, the main aim is to save life from 2 to 5% acute blood loss which occurs during pregnancy, and also to save them from PPH related morbidity and mortality. We all know that the deaths due to anemia have remained unchanged in last 5 decades. 18 to 20% it is direct deaths, another 20%, 22% is indirect deaths, and nothing is more expensive than the missed opportunity to treat just because of a callous attitude that Hindustani and Northern theek hai. This callous attitude is bad as far as the doctor community is concerned and the nurses are concerned. They also have this kind of callous attitude. It has just gone in their minds, and that's why the emphasis is not there. And there is a red flag policy is missing, and I think this we must adopt very sincerely. Here you must remember that for every death there is a disability, near misses. For every maternal death, please remember there are 30 or more who are almost died and they lead a moribund life. For every death, there are 30 cases. Now, as for the trends in the last 70 years of iron deficiency anemia during pregnancy is concerned, I joined medical college in 1964. That time, the incidence of anemia was 90%. In 2000, our study has showed that the incidence of anemia has been 88%, and in 2021, you have just now heard National Family Health Survey study where shows it was 52%. You can see here in 2002, India stands tallest in the Asian countries as far the anemia is concerned, and today, and this particular study is no less than the Amarstrain. And now we see that in 21, the incidence of anemia is 52.2%. No doubt we have come a long way. From 90%, we have come down to 52%. But still it is above 50% is unacceptable. I will say in adolescent and people who are between 15 to 45 non-pregnant is close to 60%. In children it is almost close to 70%. And our aim is by 2047, it should be less than 5%. So I think, unless we change our strategy altogether, things are going to be very difficult. Now, as for the diagnosis of iron deficiency anemia is concerned, I'm not going to get into detail of it, but I will say that iron deficiency anemia does not develop overnight. It takes long time. And these are multiple causes, long list of what causes iron deficiency anemia. This article has been published in Lancet, but I think each one of you know it by heart. I think I want you to concentrate as far as this slide is concerned. Now, everything is rosy if your hemoglobin is normal. Your storage of iron is okay, and your transport and functional iron is also okay. The first one. And you find here if you test ferritin, their levels are normal. If you test transferrin saturation, they are also normal. But once you find the iron stores are depleted, at that time the ferritin is the first one. The ferritin becomes less than 15. And then it starts affecting the transport and the functional iron, which is circulating. Now that also decreases once there is an iron deficiency anemia has set in. At that particular stage, you will find that the ferritin decreases and transferrin saturation also becomes less. Both are less than 15 and 15. At that time, the hemoglobin level is normal. But already, lot of damage has already been done. Now, if you still don't take care of it, then you can find that even the transport and functional iron decreases to rock bottom, and that is the time that not only ferritin is down, not only transferrin is down, but your hemoglobin level also stops dropping from 12% to 11% to 10% to, down the way. So you can see is a total neglect, and that is why the treatment of prophylactic iron deficiency, prophylactic iron folic acid tablet is given even if your hemoglobin is normal. You must take it, and this is because for this particular slide which explains everything. I hope this is clear. If this is not clear, I can repeat again. So I will say that revive peripheral blood smear. All of us who are sitting here, less than 1% are getting peripheral blood smear routinely. It should be done. Don't forget to exclude hemolytic anemia, especially thalassemia. And this peripheral blood smear is required for us to know the type of anemia: macrocytic anemia, microcytic anemia, normocytic anemia, dimorphic anemia, hemolytic anemia, and pancytopenia. And it is good practice which has been mandated in this particular program of Anemia Mukt Bharat is that we should do digital hemoglobin and counsel the treatment before patient leaves the clinic. Before patient leaves the clinic, this must be done. Again, I can say that not more than 5% are doing it. 5% भी exaggeration होगा. हम आते हैं, सुनते हैं, चले जाते हैं. क्यों आते हैं हमें नहीं मालूम, पर जो कहा जाता है उसको सुनना भी बहुत जरूरी है. Now I will say that or each one of us should definitely know how to decipher parameters of complete blood count. ये हमें पता होना चाहिए. MCV कितना होना चाहिए, MCV कितना होना चाहिए, MCH कितना होना चाहिए. Each one of things we must know ourselves, and we must not forget that Menzer score. It is MCV divided by RBC. If it is less than 14, it is thalassemia. If it is more than 14, it is iron deficiency anemia. Now, again, this particular slide is very easy that you must remember this. And right in the CBC, you start doing it, then it becomes your routine practice. Now, the approach to a pregnant woman presenting with iron deficiency anemia as far as the investigations are concerned goes without saying that you will take the history and investigation, history and complete examination from top to toe. Investigation which were required for severity type of anemia, I just now mentioned, CBC and the peripheral smear examination. You will do HPLC to exclude thalassemia. You will get serum creatinine, SGOT, SCPT, urine routine and microscopy. And stool examination, again, we say always, but hardly we are getting it done. And ultrasound is used for fetal biometry and the growth. Chronic anemia causes, you must all remember it, and it's all here. That you must not forget the nutritional anemia, pernicious anemia, hemoglobinopathies, intrinsic red blood deficiency, metabolic disorders, infections, chronic blood loss, and malabsorption syndrome. Now, treating according to severity, I think I don't need to tell you. Now, as for the approach of the patient who is unstable, now in unstable patients, you definitely require additional investigations which are definitely listed on the top. And in early pregnancy, the causes of hemorrhagic shock are acute ruptured ectopic pregnancy, abortion complications, molar pregnancy, and ruptured corpus luteum cyst also can be there. And their other causes are also there. Now, as far as the late pregnancy is concerned, we all know it is abruptio placentae, placenta previa, uterine rupture, and broad ligament hematoma. Now, as the management is concerned, I think this particular slide is very clear that if your hemoglobin is more than 12, you are definitely getting CBC and peripheral blood smear done still, and you are getting prophylactic iron folic acid. And this is 60 milligram tablet plus 0.5 milligram is the folic acid. And this has to be given from after first trimester. If the MCV is less than 80, MCH is less than 27, and you find Menzer score is less than 13, you must get HPLC done to rule out thalassemia. If you find MCV is more than 100, in that particular time, you have to see to it that you get your B12 done, folate done, and you must supplement accordingly. If the hemoglobin is less than 11 gram %, you start therapeutic iron folic acid tablets, the same tablet which has to be given twice a day. And the counseling is done for deworming them as well as telling them of diet. Now in case if you find that serum if hemoglobin is 10 grams or less, that's the time that you have to get serum ferritin level done and vitamin B12 and folic acid. If it is less than 200 and the folate is less than 4, then you have to see to it that you have to do a supplementation of these two things. Now in case if you find that you have been very energetic as far as this treatment is concerned, if you give them supplementation, you make ensure that patient is taking drugs. If your hemoglobin is not rising, then it's a cause for worry. It's a cause for worry, and then you have to see what are the other causes can be as far as this iron deficiency anemia is concerned. Are there any additional factors? And in case if the hemoglobin is more than 1 gram deciliter after a month, it means you are on the right lines and continue the same things. Now here I just will say what are the flag signs. Please see to it that you do complete CBC done at least 3 times in pregnancy. If in rural areas, if it is not possible, at least hemoglobin PCV should be done by digital methods. Hemoglobin at 20 weeks is a big red flag in case if the hemoglobin is 10 or less than 10. In that particular time, it is time that you give an injectable iron. If you give an injectable iron at this particular stage, depending upon her weight and the deficiency, then you will see to it that in later part of the pregnancy, you will not be disheartened. As for the refractory anemia is concerned, where your hemoglobin is not rising, then in that particular case, think of B12 deficiency and also exclude thalassemia if you have not done it so far. So the red flag is 10 gram or less at 20 weeks, given injectable iron therapy. Injectable iron therapy, I think all of you know about it in detail, and it is, make it a policy whenever you're giving injectable iron, give this particular patient B12 as it is. And according to Dr. Manju, 1 injection takes care of 4 months. For people like me, for a normal pregnancy, we give 1 at 20 weeks, B12. But in case if we are less than 10, people like us give 5 doses of B12 injection. Very cheap, and I think the compliance is good. And in spite of that you have given iron therapy, please continue oral drugs also to see to it that a hemoglobin does not fall less than 11 gram%. In my practice, I have seen that our aim is 12, and we find majority of the patient it is 12. It is your obsession which probably will work. Now as when you people who are giving treatment for injectable iron should also learn to know the treatment of anaphylaxis, and which we will talk tomorrow.